U.S. President Donald Trump decided Tuesday to freeze contributions to the World Health Organization, with more than 600,000 cases and 25,000 deaths because of COVID-19 in America. President Trump's decision has been widely criticized. UN Secretary General Antonio Guterres defended the World Health Organization, saying the organization is, quote, absolutely critical in the fight against COVID-19. So how will the U.S.'s announcement affect the WHO's ability to act, and could the shortfall in funding hinder global efforts to contain COVID-19 and future crises in global public health? Why is the U.S. administration taking this decision in the middle of the pandemic? I'm joined from Los Angeles by Dr. Eugene, founder and CEO of Quit, which provides coronavirus screening, evaluation and testing through telemedicine and via Skype. Here in Beijing, we're joined by Mr. Xiang, a research fellow at the Chinese Academy of Social Sciences. Gentlemen, welcome to The Point. So, Dr. Gu, let me go to you first. The WHO is funded by assessed contributions, basically what's allocated for member countries to pay, and voluntary contributions. This can be by governments or by private foundations or enterprises. Now, the U.S. does make the single largest contribution, about 22% in all, and China makes about 12%. So how much of a significant amount are we talking about, and how central is U.S. funding to the World Health Organization?
Yeah, thank you for having me on your show. I believe the United States contributes around $553 million to the WHO every year. It is the single largest contribution, and it's really dangerous for President Donald Trump to just threaten to withhold funding. First of all, the coronavirus is a pandemic, and as a pandemic, it affects every country in the whole world. We are all connected. You know, even after Trump banned travel from China, from the West Coast, we found that the coronavirus spread from China to Europe, to New York City, and all the unrestricted travel between Europe and the East Coast. And it turns out that the East Coast became the hardest hit center in our country. So when Trump decides to stop funding to the WHO, this hurts a global effort to fight this pandemic, because this is a global problem. It's not just one country or one state. It's everybody.
Well, for the sake of the argument, an American farmer, for instance, would say $500 million US is a lot of money, and obviously this time, even with such funding, obviously the situation did not seem to have been helped by the U.S.'s contribution to the World Health Organization. Dr. Eugene, what would you say to the people who would ask this kind of questions?
That's a really great question, and I know a lot of Midwest farmers may be suffering during this time, and $550 million may seem like a lot of money, but just to put that in perspective, there's a lot of big U.S. hospitals like MGH, like UCSF, that have actually larger budgets than $550 million. So while it may seem like a large sum of money on its own, when you consider the fact that the WHO is responsible for the health and well-being of pretty much the entire world and monitors all our health systems, $550 million is a drop in a bucket compared to what they really need to fight this pandemic.
I think it is also important to point out that $550 million is the overall contribution that the United States, including the U.S. government, including private enterprise corporations, including foundations such as the Bill Gates Foundation, make to the World Health Organization. Actually, for the period of 2018 to 2019, the assessed contribution of the United States from the U.S. government was something like $59 million US. So it is much more significant. So, Professor Liu, let me go to you. President Trump says he is freezing this to allow his administration the opportunity or the time to review WHO's role in combating the virus. Is this the true reason, according to you?
No, actually, I believe President Trump is just want to find somebody to scapegoat. because you know it's totally chaotic now in the U.S. in their efforts to contain the virus, and now we see the confirmed infected cases in the U.S. accounts to some 30% of the cases in the worldwide, and the deaths accounts for about 20% of the worldwide deaths. So it's ridiculous for the President Donald Trump to suspend his contribution to WHO, and we know that WHO has played a crucial role in the global effort to contain the virus. And I believe if the U.S. government eventually suspends the contribution, it will hurt the United States most seriously.
President Trump last week blames the World Health Organization for its disastrous decision to oppose travel restrictions from China and other nations, and he also called this organization very China-centric. And yet, a couple of weeks earlier, on February the 25th, he actually tweeted this. He said, "The coronavirus is very much under control in the United States. We are in contact with everyone in all relevant countries. CDC and World Health have been working hard and very smart." I believe he was talking about the World Health Organization there. "Stock market starting to look very good to me." So, Dr. Gu, what happened that he changed his assessment of the World Health Organization? Because the World Health Organization's recommendations have been consistent.
Right. You know, the World Health Organization actually declared a global health emergency on January 30th. And Trump kept tweeting many weeks after that this is just a flu, the coronavirus is nothing to worry about, there's only, 5 cases in the United States. He thought that the economy and protecting the stock market and the Dow Jones Industrial Average was much more important than protecting the lives of the American people, and he kept downplaying the pandemic because he thought that it would hurt his re-election chances. Now that he's basically caught red-handed, that he downplayed the pandemic on Twitter, on national TV, in all the press conferences, now because he feels that responsibility of doing that, he's scapegoating the WHO and blaming the WHO, blaming China, blaming anybody that he can except for himself. But as you know, the President of the United States is like the captain of the ship. The final responsibility rests with Donald Trump. And he has to accept this responsibility, move forward, and protect the American people using all the power that he has, rather than blaming others, rather than threatening to withhold funding. This is not how a world leader of the biggest superpower in the world should operate.
Well, the basis for the president's anger at the organization was reportedly his contention that it was too quick to believe information about the virus coming from the Chinese government at a time when it should have been more critical. He said the WHO wittingly took China's assurances to face value and pushed China's, quote, misinformation. Mr. Liu, how do you respond to that?
Great question. Actually, the Chinese government has worked with WHO very closely. As early as on the 3rd of January, the Chinese medical authorities informed WHO about the newly found pneumonia without causes. After that, the Chinese medical authorities kept close communications with WHO about everything related to this pneumonia, especially about identifying the virus. So the fact is, just based on the accurate information obtained from China, the Executive Committee of WHO declared on the 30th of January that the virus outbreak had met the criteria for a public health emergency of international concern, and urged all countries to take a global coordinated effort to enhance the preparedness for containing the virus outbreak.
Yeah, well, I think all of the alerting messages, all of these sound bites have been there. We have heard them. It seems that they just don't seem to get through to the U.S.'s administration or the, the population who follow President Trump very closely on what he says. Let's take a look at what some of the celebrities, personalities have been talking about President Trump's decision. For instance, Bill Gates says this decision is as dangerous as it sounds. We know that the U.S. administration has been trying to withdraw from the multilateral international order. They have been withdrawing from multilateral agreements and organizations. So, Dr. Gu, do you see this also as just another convenient step for the U.S. to go further in its America First path, or is it an isolated step? Maybe, it's a bluffing to shift the blame, or it's hot air to shift the blame, and later on maybe the U.S. administration will come back without really going down that path.
That's a great question, and Donald Trump does have a history of making these blustering threats and being full of hot air, but in the end he doesn't actually follow through with the outrageous demands that he has. For instance, just recently he threatened to bomb all of Iran's cultural sites and wage like total war on that country, but then when it came time to it, he actually didn't do that. So this may be part of his kind of campaign rhetoric, kind of like he makes these threats, he threatens to withhold funding to the WHO, but at the very end, after the news cycle dies down, he may not actually follow through with it. I hope that's the case, but it's still very dangerous for the President of the United States to threaten to withdraw our country from the rest of the world, to cut funding to important health organizations. This is not how we show leadership in the world. I
think it needs to be said that half of the WHO funding is actually spent in Africa, in the more vulnerable parts of the world. In response to this announcement, the UN actually listed 5 reasons why the world needs the WHO to fight COVID-19. For instance, it is to help countries prepare, provide accurate information, ensuring supplies for health workers, training and mobilizing professionals, and coordinating international efforts on developing a vaccine, so on and so forth. And the WHO's particular concern is towards the world's most vulnerable populations. So, Dr. Liu, by just threatening to cut funding to this organization doesn't mean that the U.S. doesn't really feel that it's gaining, or the U.S. administration doesn't feel that it's gaining much from membership in this organization. If other parts of the world are in trouble, what happens to the U.S.?
Yes, from the beginning of the Trump administration, we have seen the general trend in the U.S. that the U.S. government want to take less responsibility to the rest of the world, especially the poor countries. So now the question for me is that, okay, forget the U.S. Even if they don't take care of the poor countries, the U.S. government should take care of their own people. That's the real problem. Now we are seeing tens of thousands of people dying in the U.S. So it's a very unfortunate fact that.
Yeah, well, also given the globalization, given the travels that people, conduct between countries, if you go from Africa to the United States, if people in Africa are not taken care of in terms of public health, they could well bring that kind of risk, or from any other parts of the world to the United States. So you really can't say that. I want to ask this last question really quickly to Dr. Gu, because the Wall Street Journal says it's believed the defunding of the WHO is part of a broader push to curtail China's growing global influence. What would be the U.S.'s defunding of the WHO? Because that would do exactly what they were cautioning against.
Well, I know that Trump gets into a lot of trade wars with China, and China is our biggest competitor when it comes to world influence, when it comes to the economy. Mm-hmm. And as an American, my loyalties lie with the United States, even though I'm protesting Donald Trump for all of his abuses. And I don't think that Trump is threatening to cut funding to the WHO in order to hurt China's rise in the world. I think he's doing this just to protect himself, just to scapegoat the WHO and escape responsibility for his own inactions in the early part of the pandemic.
All right. We have to leave it there. Many thanks to Dr. Eugene Gu, and many thanks to Mr. Xiang from the Chinese Academy of Social Sciences.